Breaking into your regularly scheduled programming to take you live inside UW Medical Center in Seattle, where the first vaccine for COVID-19 in Washington state will be administered in just a few minutes. Obviously, this will be really a major milestone in the fight against the pandemic that in our country started right here in Washington state and of course has spread throughout the country and has taken over the world and all of our lives. So we've got a lot of coverage planned for you. Again, Steve Bunin with you here in our studio.
And I'm Amy Jung up in the newsroom. More than 60,000 coronavirus vaccine doses arrived in Washington state yesterday. And now we are just moments away from watching 12 people get the very first COVID-19 shots. This is considered a soft launch with the bulk of the vaccinations beginning later this week and early next week. But as we just talked about, we're just going to be seeing the first 12 people get vaccinated in just a few minutes.
And then if you're saying, well, wait, I thought there were all these thousands of vaccines. Well, yes, today is these first dozen, but then the rest of what's called phase 1A in our state begins Thursday. And that is when a bunch of high-risk healthcare workers, as well as high-risk patients, first responders and staff at long-term care facilities, they'll all be getting it. Now, that's not everyone who works in any one of those industries, so to speak, but those are going to be the first people. About 500,000, in fact, fit into this category here in our state.
So Washington state is expecting more than 62,000 doses of Pfizer's vaccine this week. More than 10,000 will land in King County. And you can see from this map some of the other doses and which counties they will go to. Snohomish and Pierce counties are not on this map, but vaccines will be going to hospitals there soon. More than 200,000 additional Pfizer doses will arrive in our state by the end of the year. Now, Moderna's vaccine is expected to receive FDA approval this month. 183,000 of those doses could arrive in our state by the end of the year.
And King 5's Callie Greenberg joining us now live outside UW Medical Center in Seattle, where there is a lot of anticipation. Callie, so what are we expecting to happen here?
Yeah, it's a historic day here at the hospital. It's one many healthcare workers have been waiting almost a year for. Some of them in this building right now helping people battle through COVID-19. Now, those 12 individuals, doctors and nurses, are inside of this building. Any moment now, we'll be able to take you live inside to show them getting those first doses of the coronavirus vaccine. This is the Pfizer vaccine, so it needs to be kept at an extremely cold temperature. So overnight into this morning, they were working to thaw those vaccines for these 12 people. It was yesterday that they had 3,900 doses dropped off. In fact, take a look at this. This is video of that first vaccine drop-off here in Washington state. It was 3,900 doses. Again, that's a small number compared to what the state is expecting. But I spoke to UW Medical Center's chief medical officer, and one of the things he said when he saw those doses be unloaded off the truck was what went through his head was just excitement. He really put this into perspective. Things have gone full circle. If you think about it, Washington state had the first confirmed case. Washington state had the first death from coronavirus. And here we are now seeing the vaccine, something healthcare workers have been waiting so long for. So any moment now inside the building here, those 12 individuals are going to get those first doses. Again, doctors and nurses, these are going to go to healthcare workers. And then starting on Thursday, that is when the UW medical system is going to have clinics throughout their different locations to get healthcare workers vaccinated in the dozens, possibly even the hundreds. This is similar to a picture we've been seeing across the country now with healthcare workers lining up to get vaccinated. Again, we're waiting for those first doses any moment now, but for now, I'll send it back to you guys in studio.
All right, Callie, and I know that we've been following, of course, the vaccine very closely since it was approved for emergency use by the FDA. What have you learned about how quickly things have developed since that point?
Yeah, and it was last week that I was talking to Dr. Larry Corey. He's a UW professor. He is also the head of the U.S. COVID-19 Vaccination Center. And what he told me is this process logistically was a huge undertaking just to get the vaccines shipped out from the East Coast to the West Coast and then to the hospitals. And so far, it looks like everything is running smoothly from point A of getting FedEx to send those vaccines out west to getting them here to the hospital. And now the next step is to get them to those healthcare workers. What happens after that? When I was speaking to the chief medical officer here at this hospital, he said, this right here, this is the hub for the vaccine. They're going to create a network to get the vaccines to the other locations.
All right, Callie Greenberg reporting live outside UW Medicine, and right now inside the hospital, the president of the hospital and clinics, Lisa Brandenburg, is beginning a news conference, and we'd like to join that live here on this historic day.
We're about to start, so if everybody can just quiet.
So obviously with her mask on for the COVID protocols, it's hard to tell when she was going to begin speaking, but clearly she is getting ready to speak. UW Medicine has got 3,900 doses at 4 sites that will start going out on Thursday. We know that. And those 4 sites are Harborview Medical Center, Valley Medical Center, and then UW Medical Center Montlake, as well as UW Medical Center Northwest. So about 4,000 doses at the 4 sites. Will be starting on Thursday. Today, we're going to get the first 12 people in our state vaccinated, the first dose of the vaccine. Again, they'll have to come back in 3 weeks for the second dose, and that's just the Pfizer vaccine. We're expecting Moderna's vaccine to be approved within a week or so here in our country and get out before Christmas, which should help the cause as well. So again, this is Lisa Brandenburg. She's not a doctor. She is the president of UW Medicine Hospital and Clinics, and she'll be beginning this news conference momentarily here in Seattle.
And then after this news conference, Steve, we're going to start seeing the first of these 12 frontline employees get the
Well, good morning.
COVID-19 vaccine. Let's listen to what Lisa has to say.
I'm the president of the UW Medicine Hospital System, and I couldn't be more excited than to be here today to welcome you to UW Medicine in this milestone event in our fight to end the COVID-19 pandemic. This is such an exciting day. Yesterday we received about 3,900 doses of the Pfizer vaccine, which we distributed to our 4 hospital campuses: Harborview Medical Center, Valley Medical Center, UW Medical Center, the Montlake and the Northwest campus. With this first allotment, we'll begin to vaccinate our frontline healthcare workers most at risk and our community partners, including people from the Seattle Fire and Emergency Services. At UW Medicine, our first group of eligible workers is represented here by the employees here today who come from all of our 4 campuses and across our various disciplines. And I want to thank each of them for their service to UW Medicine now and through these many months of the pandemic. They are the true stars and heroes of our fight against this COVID-19 pandemic. So now I'd like to introduce my colleague, another star in the fight against the pandemic, Dr. John Lynch, who has led the medical teams since the pandemic started. Dr. Lynch is the Medical Director of Infection Prevention and Control and an Associate Medical Director at Harborview Medical Center. John? Here,
Thank you, Lisa. And I'd also like to just take a moment to say thank you for your leadership throughout this pandemic. It has been absolutely wonderful and inspiring. Thank you. So the word for today is momentous. I've heard this over and over again today through many different meetings that I've already had today. As you said, we've been waiting for a vaccine for months, and it's finally here. I just can't believe this. While the Pfizer-BioNTech vaccine has been developed at record speed, I just want to make sure that everyone fully understands that all steps have been taken to ensure the safety of this vaccine. Just lots of work has been done. We're in the middle of a pandemic, and the folks who have worked on both the research part of this and the clinical testing of it have followed all appropriate steps, some of them concurrently and in new ways, but really building on many, many years of study and understanding of how these vaccines potentially could work. We do have an emergency use authorization granted by the FDA to use this. This is different than the FDA approval. We hope to see that in the near future, but we have moved as quickly as possible to follow that EUA, that emergency use authorization, for the vaccine like we've used for many other medical tools we've used this year, such as the monoclonal antibodies, remdesivir, and other drugs. This technology is using messenger RNA, which is like a blueprint for the protein that provides sort of the lock and key mechanism for the virus and our cells. This is, again, a new technology that has been well studied for many, many years, and then has gone through, again, all of the important FDA approval processes over the last several months. Many of our own researchers here at UW Medicine have been working in this area as well and bring that expertise to our deployment of this vaccine in our community. And it is important to recognize as well that even before this pandemic, several vaccines based on this technology were already in clinical trials and been tried in both humans and in many different other models and have shown quite a bit of promise for many diseases. This week, we will begin to vaccinate our first priority group, which includes nurses, doctors, therapists, environmental services, and other staff who work with COVID-19 units, emergency departments, respiratory care centers and labs, as well as screeners and safety officers at our hospitals. As Lisa mentioned, some of those folks are right here and ready for our first group of folks to be vaccinated. I am not part of that group. I am not in group 1. I think I'm in group 2. I'm very excited about getting vaccinated, but I will wait my turn because that's what the appropriate thing to do is in terms of my potential risk for exposure to COVID-19 and my work with patients. In the months ahead, we look forward to making this vaccine to all of our employees and patients. I want to emphasize that, all employees and patients in the coming months and as fast as possible. As we do so, we'll provide answers to questions about the vaccine on our website, uwmedicine.org, to encourage full participation. It's how we will finally end this devastating pandemic. And I'll just make a note that when we looked at our first group of folks who were given the opportunity to make appointments, over 90% of them have agreed to get vaccinated, which is astounding and very, very reassuring to me. They're taking that opportunity to make this and really demonstrating what we all need to do going in the future. But I do want to remind everyone that the vaccine, while it is the light at the end of the tunnel, it's the way we get to population immunity. We're not there yet. We still have a long way to go, not only around vaccine deployment, but we need to continue to take in all the important measures in our communities to keep everyone safe until we get to that eventual goal. We are unfortunately continuing to see a large number of folks who admitted to our hospitals, our acute care units and our ICUs, coming to our emergency departments and our clinics, and unfortunately are maybe staying at home who are newly infected, both locally in King County, but across our state and across our region. At UW Medicine, the current number of patients in our hospitals with COVID-19 is basically the same as it was in the spring when we first dealt with this, now in our third large surge. And it feels like in many ways where we were many months ago, despite having this brand new and amazing tool in front of us. So even with the vaccine in place, it is critical that we can maintain the health and safety guidelines of masking and physical distancing, keeping the sick away from the non-sick to avoid more infections. We succeeded in flattening the curve. Hopefully everyone remembers that term that we used so frequently in the spring. We can do it again. We know the tools that work beyond vaccination right now, today, that can help to reduce those numbers. And it's important that each one of us takes personal responsibility and leadership in our communities and our families and our friend group to make that happen. We succeed. So like Lisa, I am grateful to the employees who have volunteered to represent our frontline workers. You are all my heroes for your dedication to our patients and your coworkers. So with that, I would like to begin our first vaccinations at UW Medicine. Thank you. I've been waiting 9 months to say that. That is fantastic.
So the president of UW Medicine calling this a milestone event. We're just about to watch the first nurse at UW Medicine receive the first COVID-19 vaccine in our state. Just imagine what she must be feeling, Steve, as a frontline healthcare worker during this pandemic, being among the first to get vaccinated across the country.
Yeah, and among the healthcare workers who have to be extremely strict, no exceptions in terms of wearing a mask, entering and exiting the hospital every single day, often more than 5 days a week through the length of this pandemic. And we've seen other healthcare workers across the country yesterday and today say that it feels like a regular shot, like a flu shot, like anything else when you go to the doctor. Of course, some people do have some mild side effects, but they appear to be passing within a day, if not half a day or less. And so it's not that the what's going to transpire is going to be transformational, but just the fact that we've all waited so long to see this. And again, I think it's worth mentioning, Mimi, that it's a long time for us to watch, but for scientists, they have marveled at how fast the vaccination process has taken place. It's usually more, multiple years, if not 5 years or more, and they got it done in less than a year in this case.
And not to mention, this isn't the only vaccine, Steve. We've got the Moderna vaccine headed for FDA emergency use authorization perhaps later this week, and those vaccine doses could be arriving in our state by next week. So we're just not talking just about one vaccine. We're watching, again, one of the 12 people who are getting vaccinated for the very first time in our state. Dr. John Lynch, the medical director of infection control and prevention at Harborview Medical Center, calling this day momentous, saying that he's waited 9.5 months to be able to see this happen. And 90% of the workers who are eligible for the vaccine at UW Medicine have already signed up to get the vaccine, which is great news. Yeah, no kidding. And of course, the rest of us are waiting on the edges of our seats to see when the population will, in terms of people who can access this, when it'll be expanded. But for now, scientists, politicians seem to agree it should go with the healthcare workers first, who are most at risk, and then following that, nursing care home residents who are at high risk, as well as first responders. And this is what we've been waiting for. And you think back to February, March, and the first stories coming out of Wuhan, and then here at SeaTac Airport. I remember, I'm sure you do too, Mimi, sitting in this studio, and how different our lives were back then, February, March, compared to now, in this moment we're watching together. A moment coming full circle for us, Steve. As you mentioned, here in our state, the very first coronavirus patient and the very first coronavirus death here in our state. And now, about 11 months after the first person who was diagnosed with coronavirus in the United States, we are seeing the very first patient here, the very first person to be given the COVID-19 vaccine, this Pfizer vaccine that is being given to frontline medical workers at Harborview Medical Center, the University of Washington Medical Center at Montlake, as well as the Northwest campus. I'm wondering how this nurse got to be the very first one. We're actually going to be hearing from some of these healthcare workers after they get their shot, and so we'll find out. Here we go. And that's it.
Yeah, it's pretty rudimentary, right? I mean, there's no fireworks. You've heard applause in some other area of the country, and now we get it here in Seattle as well. Just, again, administering the shot is not the difficult thing. Storing it at that sub-freezing temperature, the delays and the waits that we've had, that the medical community has had, and what they go through every day. Some of those of us who have been able to work through the pandemic, we're all blessed, certainly for our jobs, and we've all had different restrictions we'd had to go through. But imagine the healthcare workers going through this. Let's hear from her now.
Diagnosed case, first death here in Western Washington. The frontline medical workers in Western Washington have been on the front lines longer than anybody else in the country. What does this mean to you? How are you feeling?
I feel excited, and for the first time in a while I feel hope that there is an end coming to this. It's just been a long, exhausting road, and I think we're all ready for this to happen and for immunity to happen. I know we're still a long time away from that, but we're taking steps towards it, and it feels really good to be making the steps towards it.
Amy, one more question. If there's anybody out there who has doubts
or is concerned or nervous about taking the virus, just based on your experience, what you've seen, what would you want to say to them? And the example you're setting here today, you can touch on that too.
I have worked in the COVID ICU since it started. We've seen a lot of terrible things there. If this can prevent you from ending up in that ICU or prevent you from losing a loved one, I think it's just super important. It's a horrible, horrible disease. And I think, like you said, being a role model, being one of the ones that are out here willing to get this, I think it's really important to show that. And watch us, let us be your example, let you see that, you know, nothing bad is happening to us, and then step up, because it's time for people to step up.
So just hearing her talk about her excitement and feeling hope for the first time in a while. I think people watching this right now are also feeling the same thing. Being able to watch the first person in our state to get vaccinated for COVID-19, the beginning of the end of this pandemic.
Yeah, and it will be a slow rollout, to be sure. Again, this is just 12 workers who are getting it today, but the rest of the first in line healthcare workers, so to speak, will be getting them Thursday. And of course, this is just our focus today is what's happening Seattle, King County, because that's where the most residents are in our state. But rural communities will have a longer wait, to be sure. This is not going to be a snap our fingers and we're out of this yet by any means, as each of these people, of course, have to come back in 3 weeks for the second dose for it to be 94% effective. And then the rest of the country, in some descending order of, quote, importance, will be getting it as well. Dr. Anthony Fauci, as well as Dr. Larry Corey, who Callie mentioned at the top, has joined us numerous times over the last couple of weeks. He's heading up all the vaccine trials in our country, and he's based right here in Seattle. They both say it'll be spring, maybe March, April, May, before the rest of us are getting our first doses of the vaccine. And then if you plow out, 3 weeks from there, add the Moderna vaccine and maybe the third one that seems to be in line, AstraZeneca, Mimi, then we're talking about spring or summer where we are at some semblance back to normal, although they all still say we should be wearing masks deep into the summer.
Well, if you just got goosebumps watching that first person get vaccinated for COVID here in our state, you are not alone. Although this might be the first, we're going to be seeing the scene in different locations, in different parts of our state, starting on Thursday, because again, our state has received 62,000 doses of the Pfizer vaccine. The first distribution going to 17 different sites across 13 counties, and more doses expected to arrive over the next couple of weeks through the end of the month. So these vaccinations will continue. This morning, Steve, we were watching people get vaccinated in Ottawa, Canada, in New Jersey, in Florida. And so now we're actually able to see the first people here in our state, in King County, in Seattle, getting the COVID-19 vaccine.
And we do expect this to play out over the next hour or so, leading us right up to King 5 News at noon, where we'll continue to see these 12 frontline workers getting the shot. And then presumably, if we keep the pattern that we did with the first individual, we'll maybe have a couple of questions for each of them throughout this hour. As I don't know about you, Mimi, but for me, it's certainly, even yesterday and the day before, the news that the vaccine had been essentially approved for, at least for emergency use, and that it's coming, it's on the way. Not just the ceremonial movement of it, but it does feel like a changing in the direction of our country.
Yeah, hope is the one word that comes to mind, Steve. Just being able to show this to you live on TV as it's happening. Again, the second person now to receive the COVID-19 vaccine is this woman right here. And there you go. She seems pretty happy. I can see her eyes are smiling. She's smiling underneath her mask, you can tell. But no, Steve, I mean, we've been talking about this for quite some time now. It's so fast that this has happened, but at the same time, it's really hard to believe that we're actually seeing people get vaccinated for this virus, and that this might be the end, beginning of the end of this pandemic, that we are just getting into a really tough season during this pandemic with a third wave. Let's listen into what she has to say.
Especially among ER, because we don't know if they have COVID. We're the first people testing. So I think there's a lot of fear of, are we wearing the right PPE? You know, people come in with abdominal pain, nausea, vomiting. People have come in to the ER with abdominal pain, nausea, and vomiting forever. Is it food poisoning? Is it in your appendix rupturing? Or is it COVID? There have been so many cases where we don't think it is, then all of a sudden the test comes back positive. So I think this will give a lot of peace of mind to me and my coworkers to know that it's another thing to keep us safe in addition to the PPE we already have. Thankfully, UW has been great in everything they've provided us. We haven't been told there's any shortages among us. We've been very fortunate, but this is just another way we're being provided for. So very excited.
You mentioned your family. You were worried about taking you home to your family. Tell us a little bit about that.
I think that's a natural fear among us. We are always worried about caring for people, and it's a risk that we're willing to take, and we made that decision years ago when we got into healthcare, but it's hard to know your loved ones. They didn't make that choice. I mean, they do, and they love you, and there's no stress from them at all, but it's just something in the back of your mind.
Who do you have at home?
Just my fiance. So no kids, no loved ones, but sorry, that's not what I mean. Love him very much. No parents, no children, no grandparents that are super at risk. I'm sorry.
Former fiance.
We're both young and healthy, and that's fabulous, but that doesn't mean there's no risk. And he still has to work in the office as well. He doesn't get to work from home, so it's just something that's always there.
So that's a nurse who works in the emergency room. Just imagine the stress, the fear, the anxiety that she must be feeling as she comes into work every single day, not knowing who she's going to come across, what patients might have COVID, what patients may not. That's a risk that you heard her say. She and so many healthcare workers know that's what they got them. They went into this profession knowing that those risks are there, but certainly not knowing that they'd ever be in a pandemic and have to be faced with this level of risk. So to be able to be among the first to receive the vaccination is giving so many of these healthcare workers peace of mind and just a sigh of relief. I get the sense that there's just a sigh of relief that they're feeling right now.
And these are, again, some of our neighbors who have seen the most sadness and witnessed it firsthand. Loved ones who have struggled literally to breathe, and in some cases have a great turnaround, and in some cases don't. And what they have been dealing with mentally every single day for 10 months on end. And one of the things that occurs to me that makes this so meaningful is that these are the sort of faceless heroes, right? Everybody knows Dr. Fauci now, and maybe in King County people are familiar with Dr. Jeff Duchin, or Governor Inslee is making statements. But these are the people on the front lines every single day, taking on high risks and trying to just save each other from this pandemic. And how meaningful it is for them to now, whether they've got a mask on or not, to become sort of the face of this movement is really powerful to me.
We have to gently invert the vial 10 times before we add the sodium chloride, and then we do that again afterwards. And then we take out the equal amount of air so that the vial doesn't have any pressure and doesn't have any risk of spraying.
A little bit nervous this morning? Nerve-wracking?
Nervous, excited. Yeah, I mean, you don't want to spill any of this on the floor, right? So absolutely. I mean, this is an incredibly exciting opportunity for us. Again, just amazing how many people are a part of this to make this happen and to get it to today.
Can you say and spell your name for us?
Yes, my name is Michael Alwyn, Michael, and then Alwyn, Alwan.
One more for you. It seems like it's a
technical specific process, what's the most concerning part? I mean, all these elements have to be right. Like if it's not cold enough, then what?
Yeah, so I think the storage requirements are certainly very specific and something that we're really focused with. I think when we look at each step of the process, our goal is to do it safely and quickly because we know that we need to be efficient in getting this vaccine out and getting as many people vaccinated as we can. And so I don't think we look at it as just one that's concerning, but we're really laser focused on every step of the process to make sure we have our processes in place.
Thank you, Michael. Thank you, Michael.
Thanks.
Joseph, how you feeling?
Yeah. Yeah, I'm great. I'm great.
Excited? I mean,
Sure,
what
why not?
does this mean to you?
There's still, there's light at the end of the tunnel, somewhat. Still gotta keep the faith. Still gotta press on, take care of the ones around us, co-workers, families. Keep the social distance going.
Did you have any hesitation about having the shot, and why or why not?
No hesitation. We're all kind of excited. Just gotta keep on pressing. Just like I said, keep the faith. I'm all for it. Gotta convince others. To be for it. Gotta keep their mind at ease.
How does working in environmental services?
So we're hearing from yet
I
another
deal with a lot of the biomedical waste that runs through the hospital.
employee, somebody who works in environmental services at UW Medicine.
I'm right there with it, touching every bit of it. But my manager Tim, he's got a lot of knowledge for me and given a lot of the PPE, stuff necessary to protect ourselves, and just not ourselves, but the people around us, our coworkers, patients.
So we're about to watch the third person receive the COVID-19 Pfizer vaccine at the University of Washington Medical Center.
And if you're just joining us, Steve Bunin with you, along with Mimi Jung, in our special breaking news coverage of the first 12 people in Washington state to get the COVID-19 vaccination. The rest of the frontline workers who are sort of first in line will get these shots on Thursday at a handful of different locations around our state, including, but not limited to, the 4 UW Medicine locations: Harborview Medical Center, Valley Medical Center, UW Montlake, and UW Northwest. This is sort of the, if you want to call it a soft rollout, this is the first 12 who are getting it for the cameras. We won't be there for every single round of these, of course, but this allows you and us to see this together and the public to see exactly how it happens and perhaps assuage some fears, as we are now having 3 people vaccinated, the first round of the vaccinations in our state. They'll all come back in 3 weeks for the second shot, and at that point, it should be 94% effective, which is, as we've talked about, Mimi, over the last few days with all of our medical experts, a much larger number than many vaccines, including the flu vaccine, which often comes in at about 50% efficacy. And this one has been testing at 94%, about the same for the Moderna vaccine, which will be coming to Washington state, we believe, by Christmas.
So there you see, an employee who works in the Environmental Services Department just got vaccinated for COVID-19. We're also expecting to see a Seattle Fire Department paramedic, a flight nurse, also get inoculated at this soft launch here at University of Washington Medical Center. We just saw the second person was someone who works in the ER, and we're going to be continuing to show you live coverage as these volunteers get to be among the first to be vaccinated for COVID-19.
And in terms of the rollout, Mimi, you mentioned, so we in Washington state, we are going to get about 62,000 doses of the Pfizer vaccine. and they will be at first going to 17 sites in 13 counties. Now, we've got nearly 40 counties in Washington state, so this is not a panacea. Not everyone is getting this. Not every hospital is getting this. There are going to be people in need on the front lines in these other counties, rural counties especially, that will still be waiting. So as excited as everyone is, it's, I think, worth mentioning repeatedly that this is not the end. This is, as you said, Mimi, earlier, the beginning of the end, and it'll be a slow phase that experts say that there are about 500,000 people in Washington who will be eligible for phase 1A. Those are the frontline workers, people living in nursing homes, and first responders as well.
Never before has a vaccine been developed and approved as quickly as this one. And although it is done in record time for many families of the 300,000 people who have died in this country since the pandemic started, this vaccine didn't come soon enough. So we think about all those families. We think about the nearly 3,000 people who have died here in Washington state, as we are in the middle of a steep curve in the number of COVID cases right now. People are being asked to stay home, to not gather during the holidays with friends and family, not people outside of their household, to continue to social distance. And those are the things that will continue, wearing masks and social distancing, even after these vaccines begin to get rolled out and more people get vaccinated. And here we go. We've got another person, a fourth person who has signed up to volunteer to get the COVID vaccine. This is really exciting. It's hopeful. Gives me goosebumps just to be able to watch this happen live here in our state. We've seen this happen over yesterday and earlier this morning in other states. But this is the scene that we'll be showing you over the next few weeks as these vaccines start to continue to roll in. Moderna is their application is going to be reviewed on Thursday, and if emergency use authorization is granted, we should receive here in Washington state another 183,000 doses of that vaccine as well. So the first wave of people getting the vaccine will begin on Thursday, and then by January, Steve, we're going to start to see weekly shipments of the vaccine. So these vaccinations will continue.
And if you're tuning in wondering where is New Day, we are doing a breaking news coverage here of the first vaccines in Washington state coming in at UW Medical Center in Seattle.
Lucky.
Let's listen in to this gentleman who's going to be the fourth person to get the shot.
How often do you get up close and personal with COVID patients in your job?
So we never really know. You know, we respond to 911 calls, and a very common complaint on 911 is respiratory difficulty. But as I think we all know, there can be a lot of different symptoms of COVID. I've worked on the testing teams, the fire department testing teams, whether at the mobile sites or the drive-up sites, or the mobile teams that have gone to nursing homes. And in those situations, same thing. We feel, people are showing up to get tested because they have symptoms, and so I feel like we see it relatively often.
And what does that uncertainty do for you?
It makes me double check in my head and make sure that all my gear is on correctly. Just at this point in time, it's pretty routine for me anyway to always be thinking, like, how is my clothing? How's my PPE? Did I put it on correctly? Did I take it off correctly?
It may be obvious why you're getting the shot, but in your own words, tell me why.
So, for paramedics and firefighters to be vaccinated, it's gonna just help us do our job safer, maybe more efficiently. But it's also our responsibility as part of this community to do this, because we all need to do it. It's time for everybody to step up with this opportunity.
A lot of firefighters have had COVID.
How many?
I know a lot of firefighters have had COVID.
Yes.
Do you mind sharing if you've had it?
I have not had it.
So this paramedic talking about his job and how he's feeling before he's about to get the COVID-19 vaccination. The fact that he's able to do his job more safe, more efficiently by being vaccinated, and to keep others safe as well. So this is the fourth person out of about a dozen people who are going to be vaccinated here at UW Medical Center in Seattle. A big day, a milestone event, as someone at UW Medicine put it. A day that is described as momentous. Really hard to believe that this is finally happening, that we are seeing the first light at the end of a very, very long and dark tunnel for so many people.
Yeah, and one that will continue, Mimi. As you know, more than 1 million Americans were diagnosed with COVID in just the past week. And by comparison, I looked at the world tracking numbers just a little bit ago. 176 countries around the world have not had 1 million cases in the entire year. And we in the U.S. have had 1 million in the last week. So this surge is going to continue, medical experts say, to get worse before it gets better, with the Thanksgiving surge numbers still just now coming in, and then expecting another surge over Christmas and New Year's. So medical experts, every single one that I've either interviewed or seen interviewed, not just on King 5, on any network, have all said the same thing. We need to be diligent, wearing our masks, washing our hands, keeping 6 feet away from each other. Doesn't mean you can't walk the dog, doesn't mean you can't have a kid go play outside. They just have to play outside responsibly, and the same for each one of us. And as exciting as it is to see these vaccinations finally happening, now the fourth person here in Washington State, we have to be vigilant and diligent and keep our guard up, sadly, for months and months to come, until the rest of us can get our spot in line to get this first dose of either Pfizer or Moderna or AstraZeneca's vaccine that we hope and expect will come, as you mentioned, Mimi, by January and February.
Yeah, and it's, gives us a little bit of hope to actually see people truly get vaccinated. We're not just talking about vaccines in development. We're not talking just about trials. We are actually seeing people get the COVID-19 vaccine. Word that, by late spring, early summer, that most of us can be vaccinated, that we can finally see the end of this pandemic and get back to a quote-unquote normal life, whatever that is. It's hard to even think back to what life was like before this, but just being able to think about having hope that we getting through, especially these dark and difficult months ahead, especially with the holidays coming up.
From remote areas of Washington, and bring them back into Seattle. But on top of that, just like with our ERs and our EMS partners, we also don't always know if someone is COVID positive because of the prevalence. And so it's been just a lot of extra work, just like with everyone else, to protect yourself so that you're also protecting your families and coworkers and everyone else.
What is this vaccine going to mean for you?
Honestly, I think it's a real privilege to be part of this first set of all of us getting the vaccination. And I think we're really lucky to be part of the UW system that really, and a state that really advocates for us to have this vaccination provided to everyone. So I think it's I'm excited to, hopefully this will be a step towards the end of a pandemic. I think we've all been working really hard, and it's been hard to keep the motivation when there's no end in sight.
I think a lot of people can relate to what that flight nurse just said. Hard to stay motivated without an end in sight. And for everyone who is facing COVID fatigue right now and who are just so longing to get back to some sort of normal life, to get kids back in school, to get businesses all back open, just to be able to see the first vaccinations in our state and the first vaccinations throughout the country, that is a sign of hope. That is a sign of the light at the end of the tunnel that is coming, and that hopefully will help people stay motivated to just hang on, keep fighting. We got this.
And you think back to the long journey we've all been through, and none more so than all of these frontline workers, but back to, what was it, February, mid to late February, when the stories were coming out of China and then first hit the United States in our country, in our area in Western Washington, Seattle, and then Snohomish County, and the timeline between February, March, then April, May, with schools shutting down and businesses shutting down, and many of them have not responded. And this, what we're zooming in on here, this live coverage inside UW Medicine, inside the hospital, is the perhaps beginning of the end. A long journey still to come, no question. Months, perhaps years, but it's a huge something. Maybe it's something, and it's a huge turn, I think.
Yeah, you're looking at that vial of vaccine right there. I've never been so excited to see a vial of vaccine, right? It's like liquid gold. Don't drop it. Don't spill it. All of these doses are critical. Again, this Pfizer vaccine, it's a 2-dose vaccine. It will be given 21 days apart. The trial data shows that this vaccine is 95% effective about 7 days after the second dose. So you won't be fully protected until about 1 to 2 weeks after you get the second dose. So it's critical that all of these people come back for this second dose. I don't anticipate that being a problem with frontline healthcare workers. But there have been no adverse side effects so far, according to the trials. And the first person to receive the vaccine here, just about 40 minutes ago or so, was a COVID-19 ICU nurse at Harborview, and she said that it hurt less than a flu shot. So it's pretty much looks like your average vaccination.
And it's worth also, I think, highlighting the effort it takes to keep this vaccine stored at its proper temperature, which is well below freezing, well below normal, compared to the Moderna vaccine, which is stable at a standard refrigerated condition, which is 35, 45 degrees Fahrenheit, whereas this is 70 degrees below. And that makes the process of getting it to everybody's arm that much more of an uphill climb. And I think it's important to salute the effort that it takes to get it there, and the care with which each of these administers, whether it's a nurse or a doctor who's giving the shot. It is not a standard vaccine in terms of storage, like perhaps the flu vaccine. And the third one that's in the pipeline, the AstraZeneca, is also believed to be much easier to store, to move around the country, which is one of the reasons that we hope that when those are approved, the rollout will be able to come faster than this one. As we mentioned, this is just 12 people we're going to watch here live. We started about 11 o'clock here on the air, leading up to King 5 News at noon. 12 people here at UW Medicine will be getting the vaccine, but the real rollout begins on Thursday, when thousands of frontline workers and high-risk people in our state will be getting the vaccine. But even then, it's only in a handful of counties, 13 counties across our state. So this is not by any means a blanket situation where people can think about getting back to normal. Not quite yet. This is just the beginning.
Holds a much greater weight because of what we've all been through in the last, since February. I gave birth at the end of February, and so it's been a really isolating time for me, because keeping a newborn safe during all of these unknowns just held a lot of weight for me. And so, yeah, this is like the end of getting to introduce my son to a lot of people who he hasn't met yet. He has met his grandparents. He was born before the lockdown, before the stay-at-home order, so he did get to meet both sets of grandparents before.
And do you work at the medical center here?
I do. I work here on 8SA. We treat mainly leukemia and lymphoma patients, but it's a medical oncology floor.
Were you choking up a little bit as you were reading the informed consent?
Yeah, I just hold the weight of what this means for these people who are even who are more on the front lines than I am, and also the opportunity that I've been given to be able to administer this vaccine to them. So it gives me hope, and I know it gives them hope as well.
I'm sure it's been hard to come into work every day. What's kept you going?
The staff here and the patients have been incredible. I mean, the patients haven't changed. They still need us every day, and I work with an incredible group of nurses. We all really care for each other and care about each other's well-being and care about the patient's well-being, and that hasn't changed since the beginning.
Also, I was surprised at how everybody says they didn't feel it or it didn't hurt. I thought I had heard, and so clearly it's very good. So there's that. You know. But I sort of feel as though I've heard that it hurts, and so what can you tell me about that?
Technically, I don't know what gauge needle that was sent with, but the gauge needle sometimes makes a difference. These came with the vaccines, so. But I know the after effects could be what hurts. Sometimes if a vaccine is given at a colder temperature, it hurts. So it depends on, I don't know. Technique, it's my, I've given lots and lots of flu vaccines, but I don't know that that matters.
We don't have to be refrigerated for 40 minutes. So what is the ideal temperature?
What is the
ideal temperature for that?
I'm not going to answer that technical question because pharmacy is very in control of that.
But it's just, we know that it's refrigerated, obviously. We could never.
Yeah, it's good. Let me see this. It says allowed to come to room temperature for 10 minutes, so it's at room temperature. Yeah. Thank you. Yeah. Thank you. Thank you.
So it looks like we just heard from someone who actually will administer these COVID-19 vaccinations. And as we are watching the first 12 people get vaccinated at UW Medicine, we want to mention that the Washington State Department of Health, along with Fred Hutch, will be hosting a conversation to answer some of your questions that you have about the vaccine, about the safety, about the effectiveness. A lot of people I know have questions about this vaccine as it is now being administered here in Washington. So Dr. Larry Corey with Fred Hutch is one of the folks on this panel to answer people's questions, sort of making sense of the vaccines and getting your questions answered during this time. So that's at 5 o'clock tonight.
And UW Medicine did get about 4,000 doses of this vaccine yesterday morning for its 4 hospitals. We talked about at Harborview, Valley Medical, UW, Montlake and UW Northwest. Most of those will be starting to be given out on Thursday. And if you have any questions about the vaccine, the process, you can always text the word vaccine to us at 206-448-4545, and we'll send you back a link with all of the information that we have right to your phone, kind of one-stop shopping. So we encourage you to do that, whether we're on the air or off the air. If you're just looking for a little bit of information which can sort of ease any anxiety you might have, we certainly encourage you to do that.
And some of the folks that we've seen get vaccinated today, one of the reasons they wanted to was not only to obviously protect themselves, but to also be an example for those to get the vaccine, the general public, to not be afraid and get this vaccine. The more people we have vaccinated, the safer we all will be. And so some of these medical workers we've heard from this morning have said, you know, we want to just show that it's safe, that there's no adverse side effects. This is how it's done. It's just like a flu shot. Doesn't take very long. Ask you a few questions, and then we get underway. So this is now, we are looking at the 6th person to get the COVID-19 vaccine. We've seen somebody in the emergency room, somebody who works in the ICU with COVID patients, a paramedic, a flight nurse, and somebody in the environmental services department. So a variety of people who are getting the first vaccines here at UW Medical Center today.
And we're seeing this play out across the country as the first vaccinations are going out. And at the same time, we're starting to see more restrictions, Mimi. As you know, the mayor of Boston just ordered, similar to Washington State, all the gymnasiums there, indoor event spaces and rec centers are closed in Boston for the next 3 weeks. North Carolina, the entire state now has a curfew mandated between 10 p.m. and 5 a.m. as many hospitals around our country are beginning to become overwhelmed in the wake of the Thanksgiving surge that was much predicted by medical experts getting into the heart of the fall and now winter. So as we are seeing a struggle on one end, at least we are seeing a little bit of light here in Seattle and around the country with the first Pfizer vaccines going out.
Great start of the beginning to an end, I hope.
I've heard a lot of people say it takes a weight off of them, going to work, going home, loved ones, family. Tell us about that with you.
Yeah, I think it's true. It's definitely an added tool we have on top of everything else we're doing. And I think for those of us who've been dealing with this since March, it definitely feels like there's this extra protection we now have.
You just said it, we've been dealing with this since March, and here you are already getting a vaccine. Is that remarkable to you as a doctor?
It is. I think we've all been dreaming of this day, and I'm excited to be here and be part of this. Yeah, 9 months is just fantastic timing.
I'm sure you've seen messages online, misinformation. What would you say to folks who might be vaccine hesitant and seeing those messages?
I would say trust in science. This does seem like it's rushed, but all the right steps have been taken. And you know, I think there are people that feel that this is too rushed, and I'm hoping that those of us here getting the shots today will help convince those who are still a little on the edge about it.
Do you feel like being here sets the example?
Absolutely.
On a personal level, are you excited?
I'm very excited. Very excited.
So just watching these frontline medical workers get the vaccine, just imagine what they must be feeling, the level of excitement, relief they must be feeling right now as they are getting vaccinated. The first in Seattle, in our state, get to get the COVID-19 vaccine. And she just mentioned the fact that, you know, it seems like it's fast, and it is. The fact that it's been less than a year since this virus was discovered, and we have one highly effective vaccine being administered right now, with another highly effective vaccine on the verge of being rolled out as possibly as early as next week. Is really giving so many people hope at this time when we're all feeling COVID fatigue. We can't see our loved ones during the holidays. There's restrictions on travel. We're seeing businesses permanently shut down, so many livelihoods affected, just hundreds of thousands of people unemployed. But this is a glimmer of hope, Steve.
Yeah, no question. It's just, it sinks in, at least for me, in different waves. The news of the vaccine had been approved for emergency use. The news that it's starting to be shipped around our country. The news that it arrived. And then the anticipation of this news conference as we come up to King 5 News at noon in about 8 minutes. And then just seeing these people parade in. And it's a very ho-hum experience in many ways. And yet at the same time is so momentous, as the doctor said to start this news conference about an hour ago.
Yeah, and hope is a really good feeling right now, Steve. So many people feeling just. I'm just going to listen to her just to see what she has to say before she gets her COVID vaccine shot.
How do you come across potentially COVID positive patients?
I'm a critical care doctor, and I work in the medical ICU here at UW-MC Montlake and in our COVID ICU. So I'm the attending or supervising doctor in the COVID ICU.
When did you learn that you would be among the first getting the vaccination?
I think maybe a week or so ago, I learned that.
How was that?
Well, I think it's really powerful. It is an incredible moment of hope for all of the folks who are here today, for each of us individually, but really more importantly for our community. This is how we're going to take care of each other, and I think it's a really momentous moment for all of us to kind of step forward to say it's really important to take care of each other, and that's a priority for all of us. I'm ready.
She said she's ready. So we're able to see some of the faces of the medical workers that have been working so tirelessly day in and day out to treat patients who are not only dealing with COVID, but just patients in general, the risk that they take on simply because they're doing their job. We just salute you, we thank you, and to know and see that these are some of the first people to get the COVID-19 vaccine just brings a smile to my face. I do want to mention right now, we just got some news into our newsroom that Congressman Denny Heck just posted on Facebook that he was recently informed that his wife, Paula, and himself, they were both exposed to an individual who tested positive for COVID-19. He says that his wife tested positive, is having some mild symptoms. He has tested negative. They are both quarantining separately, and he will continue to fulfill his duties remotely. But again, his wife testing positive for COVID-19. He has tested negative, but they were exposed to an individual who tested positive for COVID. So that is Congressman Denny Heck, Lieutenant Governor-elect Denny Heck, announcing that on Facebook. So this coming at a time when people continue to be diagnosed with this virus and people continue to die every single day in this country. For those families, this vaccine really isn't coming soon enough.
Yeah, and cases skyrocketing in King County, the most populous county in our state and in our country. For a long time, the United States has had this horrible statistical grip on COVID, where we only have about 5% of the world's population, but about 20% of the cases and 20% of the deaths compared to every other country in the world. This vaccine, and I think this is also worth mentioning, Mimi, as important, as crucial as it is to get for everyone, and here in our state and our country, there are, experts say, beliefs that about 90% of people in poorer countries will not get this vaccine for a year. This is a global pandemic. Just because we can ideally achieve herd immunity through the vaccine here in our country does not mean that we'll be able to go to, quote, totally back to normal. So it's a global effort, and we know the Bill and Melinda Gates Foundation is putting down $250 million to help for that. Just within the last week, they put that money down. So we're seeing as you said, the tip of the iceberg, and it's important and it's momentous, and it is going to be a long wait until the world has really moved past this pandemic. But at least this is a glimmer of hope, and it is just the 12 people who are being vaccinated today. They all have to come back in 3 weeks for the second round. But then the rest of the thousands of frontline healthcare workers and nursing home residents and first responders who will be getting this, that will begin en masse on Thursday in our state. This is just the 12 to get the ball rolling and be able to get the message out to the public that it is here, and the hopefully beginning of the end has come.
And of course, all of this is really encouraging to be able to see that a vaccine is now in our state. People are being administered the vaccine, and that is giving encouragement and hope for so many people that we've been just desperately looking forward to.
To take care of each other already is so important, like wearing all the masks that you see in this room. And hand washing, I was just telling Jane how awesome her hand hygiene was, and our physical distancing. All of that is all part of the hope too, but this is like a whole new moment, and we can finally see the light at the end of the tunnel. We got some time ahead of us before we get there, but this is a super hopeful moment. It's really an honor to be part of it.
Yeah, there's what, 2 to 3 more months before, of what they're calling this dark winter.
Yeah, I mean, I think in Seattle we're used to dark winters, so I think we'll get through this. And I do think we have some more tough weeks ahead. I think the big next steps are getting the rest of our health force vaccinated and then the public vaccinated, because as I said before, I think this is about how we're going to take care of each other is by getting vaccinated. That's how we as a community can come together and really move into this next phase.
So she touched on what I was about to say, which is, yes, it's encouraging and hopeful to see these vaccinations begin, but this is just the beginning. The general public won't be able to get vaccinated for another several months. So while we're seeing this encouraging sign, it's not right now the time to let down our guard and to give up the fight. This is when we need to continue fighting, and there is a light at the end of the tunnel that all of this will be worth it as long as we continue to be diligent about social distancing and wearing masks to keep all of us safe.
You've been watching live coverage here for more than an hour of the first vaccinations for COVID-19 in Washington State happening at UW Medical Center in Seattle. Mimi, it's been a long morning and day for you, so we'll bid you adieu as we get ready to begin King 5 News at noon here, continuing to cover this and other breaking news, including Joe Biden naming Pete Buttigieg to his cabinet. We'll tell you which position. That's all coming up on King 5 News at noon. And we do continue our coverage live inside UW Medical Center in Seattle with the first vaccinations administered in our state. Health officials in the United Kingdom think that they may have found a new version of COVID, so we'll talk about that as well.
And today's system is beginning to wind up, but another one is on its heels for Wednesday. We'll give you the details on both coming up.
Yeah, that's December 15th, 2020. Steve Bunin with you on King 5 News at noon. And as you've been watching within the last hour, health